Right, well, we're here to celebrate National Health Coaching Awareness Week, a first for NHS England, and I'm going to get you to introduce yourselves in a minute. What we're going to do, we're going to have a little conversation, focus a little around your experience of health coaching, then perhaps go on to think about peer support that you've both been very involved in, and then maybe a bit about co-production and peer leadership at the end. Is that okay?
Yeah, and who are you?
Who am I? Thank you, yeah. So my name's Dr Ollie Hart. I'm a GP here in Sheffield. I'm the clinical director of the primary care network that operates out of this lovely community building here. And also a director of Peak Health Coaching. So I teach health coaching, so I'm really interested in the area. How about you, Elaine?
Oh, I'm a patient, and we've known each other for a few years, haven't we, Ollie? I've been involved in a number of different things through the practice. I'm a type 2 diabetic, and we started off doing some work around diabetes management, and that's how I got involved in things. I think I was hooked in. I opened my mouth at a patient meeting that you had, and that was it, I think. But the thing was that what was very refreshing was the fact that you were involving patients and having an honest conversation about what we needed to do and looking at it very much as a sort of team effort.
Yeah.
And I think people found that really helpful, and the work that we did involved patients right from the get-go in terms of ideas for what we were doing. We even sort of did some work on the patient peer support volunteers that we came up with, and it was really good. And I know that the patients that went through that process really benefited from it.
Yeah. Lovely. Let's introduce Frank. Yeah.
Hello, I'm Frank. I'm also I'm an ex-patient of Dr Ollie. I do suffer from type 2 diabetes. I've been reasonably successful in reversing it with the help of my colleagues and especially Ollie. So I came off insulin after being on it for 10 years. I now started a cycling group. I'm quite fit, and that's with the help of my colleagues.
Lovely, thanks Frank. Well, let's start with you. So when we talk about a coaching approach, you've obviously experienced lots of different types of approaches across your career as a patient. What do you think of as a coaching approach, and how did it feel for you?
Yeah, well, it was fantastic, especially I've had some bad experiences with wrong information, just doctors trying to get me out of the door as quickly as they could, giving me 10 minutes, not getting to the bottom of my problems, and then I met Ollie, and the coaching bit, he put it in layman's terms what I should do to reverse my diabetes, encouraged me to exercise, and it was a good collaboration between us. Neither of us was in charge. Ollie listened to what were best for me, and we worked something out. We stuck to the plan, and after 5 years I've kept my weight off and reversed my diabetes.
Thanks Frank. Let's come to you, Elaine. So what do you've had a lot of experience of coaching from various people, haven't you? What do you think of as health coaching?
Well, I think at the heart of it for me, it's about being heard and being treated as an equal. I've had a similar experience to Frank here, in that when I was first diagnosed as a diabetic, I had, I think it was 10 minutes or something, and all the doctor who I saw at the time said was, oh, you've got diabetes, we'll start you on the metformin, you probably end up on insulin, oh, and by the way, you need to lose weight, and here's a leaflet. Well, quite frankly, I went out of the door and I thought, what on earth am I supposed to do? But I was so lucky in my diabetic reviews meeting a diabetic nurse who really understood how to deal with me. I have mental health problems, and she recognised that. And then when she saw that I was in a better frame of mind. We were able to have the conversations in a very supportive way, and I ended up going to a little group in the surgery that was an exercise group, and that was my first step towards changing things in my life. And that was wonderful because it's all patients like me, and we all shared the same experience. And blow me, we all graduated to the gym, and I never thought I'd do that. So having the kind of conversation I needed it was with the right person at the right time, and it was the right thing. Yeah. And that made a difference. But I've also had health coaching from yourself, in terms of the conversations we've had with you as my GP. We don't always agree about everything.
No, it's not about necessarily agreeing, is it?
No, it isn't. And we have disagreed on things, but you've respected my decisions, and you have made sure that so long as I've had all the information, you satisfied yourself in terms of safety, that, you know, I understand the decisions that I'm making, but I've made them. And that's important. The other thing is I've had health coaching with our health and wellbeing coach, and that was because I got to the point where I felt I needed to just have some space to be able to sort out for me kind of how to manage certain the challenges I had with managing my health. And I really enjoyed that because it was about giving me the time to do what I needed, and the coach was very skilled at enabling me to feel safe. It was a private, confidential conversation. There was no expectation placed on me. I was in the driving seat. Yes, she might prompt me, but that was in a way to help my thinking. Yeah. So that made a huge difference. And
that driving seat bit seemed that sort of you being in control.
Oh,
important.
Absolutely, it was really important. And then that was probably a few years ago now, and recently I suffered a bereavement, and I suddenly realised that some of the things that I had done in those coaching sessions were still supporting me now, that I'd made changes that were still there. Right. It wasn't just a flash in the pan, it was something that was permanent.
So you'd learnt skills that you could draw on in different situations?
Yes, yes,
yeah.
That's very true.
Yeah. And I think that's the part of this, isn't it, Frank? There's the sort of sustainability. I mean, you know, I guess our relationship has changed, isn't it? Where you know, you do a lot more of the decision making and thinking about what you're doing. In fact, you're telling me the other day, as long as you've got the right tools, as long as you can check your sugars and have the right information, you're flying, really. Yeah. You know, tell us a bit about that.
Yeah, I also think, going what Elaine said, personalised care, because previously I were made to feel worthless. I was given information which it turns out now wasn't always correct. And because of the personalised care, and I got no blame. If I got it wrong, you know, we just readjusted things and worked it out what I were doing wrong, and then you could make a decision and move on. Whereas I were made to feel worthless, and a lot of criticism where you don't always get it right, and I've had backward steps as well, and still doing a few backward steps, and you readjust and carry on. But yeah,
isn't it? I think if you're being honest, actually, as doctors, you know, there's been this thing, isn't it? Doctor always knows best, and we always get it right. But actually, years have shown us, haven't we, that you know, advice changes and information and insight changes as we learn more. So actually, we've had to also say that we've got things wrong, and actually that kind of equal dynamic, that partnership feels much nicer to me working with people, and clearly it feels better to you.
Yeah. But with somebody my age, a doctor admitting he was wrong. You know, never happened. You didn't even ask what the tablets were for. You just they gave you the tablets, and you just took them. Whereas now you can have a personal relationship and an explanation, and that makes it so much easier. And
I think in the work that we've been doing more recently in the special clinic that we've got going, where we've got, you know, the patient-led support happening, patient-led sessions for patients, peer support cafe.
Yes, let's talk a bit about that, because you've been very involved in that, haven't you? Actually, we've transitioned almost from you being looking after yourself, well, you're actually now peer support champions for us, aren't you?
Oh gosh.
Well, is that the title we're using? You know, what do we call you? But it's very much around people, you know, living with long-term conditions, helping other people, supporting people, but not telling them what to do, just providing an environment for people to do the sort of things that you've done, isn't it?
Yeah, and what's interesting is, first of all, the patients who've gone through that, the way that they've been able to make change. There's something really important, I think, about that shared experience, which you don't get in when you're with a healthcare professional.
Yeah, it surprised me, actually. I mean, has it surprised you?
Well, it has.
How much progress people have made.
Well, absolutely. I'm just thinking of a lady who has been through our programme, and I think she started out probably a few months ago, and she's lost 21 pounds in weight. She's changed her eating habits. She says that she feels, you know, healthier. She's more alert, and she feels life is better.
Yeah.
And
this was the peer-led.
The peer-led
program,
session
the two
program.
of you.
Yeah.
That's right.
Occasionally, I come in and offer a bit, don't I?
Oh,
But
you do.
Essentially, this sort of 4 sessions, isn't it, is led by patients for patients.
That's
isn't it?
right. But the thing about it is that we're in the back office as well. We're part of the multidisciplinary team that runs that clinic, and we're treated as equals. And what's interesting for me is how healthcare professionals and we as patients who are peer support volunteers are part of the team, and we all work together, and it's been lovely to see how they value our opinion about what we're doing, and when we're talking about operational things, you know, getting the feedback from patients, using it as a means of tweaking what we're doing to improve things. You know, the course we run, there are 3 of us who have been involved in that as patients, and we've tweaked it as we've gone along, but the healthcare professionals have trusted us to do that, and value our knowledge and skills to do that, and have that two-way conversation. If things arise, we always involve you. If we need to, patients get a broad range of support. And it's amazing how that different way of working, and at the heart of it is personalised care and this health coaching approach. It's that equality which permeates the whole thing, that seems to be a really powerful force in bringing about change in people's individual lives.
It's lovely. And Frank, for you, has it crossed this traditional patient-doctor barrier then?
Yeah.
You wouldn't dare question the doctor before. How's that going now?
Oh no, I can say anything I want to you, and you'll give it back. But we had a review meeting last week, and all the health professionals thanked Elaine, myself and Steve for doing what we do, and we're volunteering, and I found that really great, that they treated us as equals. And actually the patients who are coming through the system now, I've learnt from them, from their lived experiences, and you know, we're learning off each other all the time. And I found that really valuable. And
that's our ambition, really, isn't it? You know, we've set it as one of our markers of the PCN, and we've agreed it together, haven't we? We're trying to enhance people's lives, but we're doing it together and involving patients as peer support. There's a little bit of a pathway, isn't there? You know, you you guys are leaders at the moment. You know, people come along, they learn some information, they learn a style of doing things, and then they start to contribute themselves. And we're already seeing that, aren't we? People wanting to join in. And
yes, we are. I mean, things like the leaflet that we're trying to put together to advertise what we're doing. There was a suggestion that came from one of the people who'd been through our clinic, that we needed to do something to improve the information given to patients. So because that's an individual who comes to our patient peer support cafe regularly now, because we have this drop-in, and I've asked, well, would you like to help kickstart getting that together, so that we get the patient view on
lovely.
what is it they need, you know.
So there's lots of opportunity to be able to get involved, and even we have an ambition, don't we, to train up more peer volunteers. In fact, I think you've got a sort of a plan already, haven't you? A few people recruited.
Yeah. We're hoping, yes.
Yes.
Sorry.
Yeah, no, absolutely. So I mean, I can see that, and I've already seen a number of people who've come through the peer-led sort of course that you've done, sort of wanting to contribute and join back in, and that's wonderful. That whole building the whole community together.
You see, it's not going to be effective if you don't do it. If you don't listen, then if you look at the way that things have been, if you think about the 70 years of the NHS, it's very much been medically led, and while there have been some wonderful things that have happened, there has been this block on being able to improve patient outcomes. And the research that I've learned about shows that when you do involve people in this way, when you also use the health coaching approach, there's a real sea change in people, in patients and their carers, to just live a more fulfilling life, that they are given the tools, they're able to do it. And it doesn't mean that they go off into the sunset and everything's wonderful and marvellous, because there are going to be times when life throws you some curveballs.
Yeah.
But there's more of a willingness that when that happens, you know where to go, that you can ask for help, you feel that you can ask.
Yeah.
And that you can do it perhaps at an earlier stage, so that you understand that if you can have the conversation when you need it. I come back to that phrase, it's having the right thing at the right time with the right person.
Yeah.
And that is so important.
So if we're going to create this culture of this coaching culture in the NHS, I can certainly see there's some work to be done with my colleagues, that they believe it's worth it, and to a certain degree they'll learn some of the skills, although they're not that difficult to learn, are they? So from a patient point of view and from a community point of view, what do you think we've got to do to embed this coaching culture in the NHS?
I think that it's allowing healthcare professionals to see from their peers that this can make a change to them. What has interested me is being part of this multidisciplinary team in our clinic, is actually seeing how healthcare professionals operate. And in conversations that I've had with them, they love that way of working. There's something about it which enables them to fulfill their potential, to not be put in a box which they find constraining and stressful.
Yeah, that's really
and it's how you manage to enable people to just lift their heads above all the rush that they have to deal with, to draw breath and say, actually, there is a different way. It doesn't mean it's going to add to your workload. In fact, it could have the opposite effect and make your job more fulfilling.
Yeah, lovely. And Frank, do you think from a patient point of view, I mean, are people ready for this? Does this feel very different?
Well, yeah, but I mean, what I've liked about this, our kickstart and then go on to the remission group, is seeing the patients arriving quite not understanding what's going to go off, and then all of a sudden joining in, and you can see their confidence getting better and really getting into it. People, like, well, I can't name names, but some very shy people, but suddenly they just blossom because they know that they're being listened to. And they also have you popping in occasionally in the kickstart groups, and seeing a doctor for 20 minutes is fantastic. And I just think what we're doing here Healy Plus is, I think it's working. It might need a few touches here and there, but if we can spread this nationwide, I just think it's fantastic.
Yeah, yeah.
You know, people, you know, criticise and say, well, you're only doing it to save money for the NHS. What's wrong with that?
Well, I
Let's
think it's a
save
win.
some money.
It's a win-win, isn't it?
Yeah.
We know it. I mean, like you're saying, Elaine, certainly my personal experience is it's really invigorated my career, having that more even relationship, and it works better. So we've got a little bit of work to do, I think, haven't we, for it to become sort of the norm for patients and for colleagues around. But it's been lovely to make such fantastic progress with you both.
Yeah.
We'll maybe wrap in a second. Maybe one last, just brief, just sort of like piece of advice. I don't know, for people out there wondering whether health coaching is going to be useful in the NHS. I certainly think it is around that sort of belief, you know, that it's very liberating to kind of be able to believe that you're going to work in a partnership, and when you allow that to happen, it's incredibly surprising how quickly people do rise up to that trust you give them. But any last thoughts from you, Elaine?
Well, people talk about, you know, the proof of something is in the pudding. Well, we've got the pudding, and because and the proof, because it's there in the work that we've been doing for all to see. Just ask us.
Yeah, lovely. Thank you. And Frank?
Yeah, well, I feel as if I'm a small cog in this collaboration, but I'm really lucky to be in at the start, because I think this is going to spread, and you know, I feel passionate about what we're doing, and you know, we've just got to keep slogging away and persuade people that this is the way to go.
Lovely, thank you. Well, thank you very much. It's lovely to have this conversation. And what I think this just illustrates to me is that we've moved from doctors and patients, we're now colleagues and friends, really, aren't we? You know, we're working this together, and it feels incredibly powerful to be sharing all our expertise together. So thank you both, Elaine and Frank, for joining us. And hopefully this will contribute to the conversation that's going on in Health Coaching Awareness Week, 18th to the 22nd of September.